When most people hear the word frankincense, they probably think of holidays, ancient history, maybe a nice essential oil.
Right, for their diffuser.
Exactly. But here's where it gets really interesting. That ancient resin, it isn't just for aromatherapy. It's actually a potent botanical medicine known as Boswellia serrata.
And that is exactly what we're digging into today. We have a whole stack of research here on this tree, which is native to India, Africa, and the Arabian Peninsula. And we're looking at its role in Ayurveda, sure, but more importantly for us, its application in modern joint health.
So our mission for this deep dive is pretty clear. We want to uncover how this Indian frankincense actually fights inflammation.
And maybe most importantly,
clarify who should and who definitely shouldn't be taking it, all based on the research.
Right. So let's start with the basics. What are we actually talking about when you go buy a supplement labeled Boswellia?
Okay, let's unpack this. We're talking about a gum resin. It's taken from the tree.
Yeah.
But the magic isn't just in the sap itself. It's in these active compounds, they're called.
Yeah.
Boswellic acids.
Boswellic acids, right?
And that is the key. That's the mechanism. According to the research, these acids work by decreasing swelling and modulating the body's immune response.
So it's like turning down the volume knob on the body's inflammatory alarm system.
That's a great way to put it. And looking at the data, the big winner here really seems to be osteoarthritis.
That's what I saw too.
It is. That's where the strongest research is. The studies show that taking specific Boswellia serrata extracts, sometimes by themselves, sometimes with other herbs, can reduce pain.
And not just pain, right?
No, it can actually improve movement in people who are suffering from osteoarthritis, particularly in the knee.
Which is huge for anyone dealing with those creaky joints. Now, I did see mentions of other uses in the notes, things like asthma or inflammatory bowel diseases.
Like ulcerative colitis or Crohn's, yeah.
And even some talk about antioxidant properties.
There is interest there, definitely, but we have to be really careful. While it's being explored for those things, the evidence is what we call mixed, or, it's very preliminary compared to the solid data we have for joint health.
And we absolutely need to make a clarification here, because I know people see things on social media.
Oh, for sure.
Despite what you might hear, the research explicitly states there is no good scientific evidence supporting its use for COVID-19, for diabetes, or for stroke.
Correct. It's so vital to separate the possibly effective from the, wishful thinking category.
So, assuming you're interested in it for your joints, let's talk safety. Is this stuff safe to just pop every day?
Generally, yes. It is likely safe for most adults when taken by mouth. The research points to safety for doses up to about 1,000 milligrams daily.
For how long?
For up to 6 months. Though, honestly, you'll commonly see dosing in studies that's much lower, more like 100 to 250 milligrams.
But, like with anything, there is some fine print. There are side effects.
There are. They're usually not major, but they can happen. We're talking about stomach pain, nausea, diarrhea, heartburn.
Basically the standard upset stomach list. I saw headaches and itching for some people too.
But here's where we really need to connect this to the bigger picture. If you are taking other medications, you need to listen very closely.
Okay.
Boswellia interacts with the liver, specifically the cytochrome P450 enzyme system.
Okay, wait. Cytochrome P what now?
P450. Yeah, it's a mouthful. It's a system of enzymes your liver uses to break down medications. Think of it like a processing plant with a conveyor belt.
And Boswellia messes with the conveyor belt.
It can act like a monkey wrench in that conveyor belt, exactly. It can change how quickly your liver metabolizes other medications.
So that can make another drug way too strong or
way too weak. It could stay in your system too long, leading to overdose effects, or get flushed out too fast, making it useless.
That is a massive detail.
Right.
So if you're on a complex medication regimen, this is not something you just casually add to the mix.
Precisely. And because it affects the immune system, there's another specific warning for immunosuppressants.
So drugs you'd take after a transplant?
For example, yes, Boswellia could alter their effects, which is a serious risk.
And I'm guessing that caution extends to pregnancy.
Absolutely. There just isn't enough reliable safety info for use during pregnancy or breastfeeding, so the advice is to just stay on the safe side and avoid it.
So what does this all boil down to for you listening? It really seems like Boswellia is this bridge between traditional wisdom and modern anti-inflammatory science.
It is, especially for osteoarthritis pain. It's a tool, but one that needs to be respected, especially with dosage and interactions.
Before we go, here's a final thought to chew on.
Yeah.
It's kind of wild to think that a tree sap used for thousands of years just for aroma or spiritual rituals might actually hold the chemical key to regulating our modern immune systems. Nature is just incredibly complex.
Right.
It really is. It makes you wonder what else we might be overlooking in traditional remedies. But remember, because of those liver enzyme interactions we talked about, please consult a healthcare provider before you start something like this.
Great advice. Thanks for diving in with us. We'll catch you on the next one.